with that, I will give it over to you, Caroline.
Good morning, everyone.
Morning.
Boy, I was just sharing with a friend that I'm pleasantly surprised that I'm quite alert on a Saturday morning. Typically by Fridays, I am completely spent, as I'm sure you all are as well. And I just have to say, Carol, I'm so glad that everyone here is very conscious about conservation, because I had a little snafu with my printer today, and there are many trees lying around my house this morning. Well, good morning, everyone. It's really my pleasure to be here with all of you today and really share what's our experience and our perspective around the topic and the issue of health in our community. And as I was putting together the remarks for today's presentation, I thought, primarily what we do as Latino Center of the Midlands is we focus on education and educational attainment in our community. What's the connection to health? Well, I hope I'm able to make a good case today for that. Latino Center of the Midlands, we've been around for just over 43 years. And since the inception of our organization, which started as the Chicano Awareness Center, we've always been focused on education and the educational attainment in our community, and that's always been a very huge point of consideration and of concern, and a big area of advocacy for the organization. Today we operate 3 core areas of programming. We have a community services and technical assistance program. In that program, we really focus on we focus on everything that comes to our doors, and that can be just about anything. We're a very popular storefront in South Omaha, in the heart of South Omaha, right on 24th Street. So we have a lot of requests for all sorts of assistance, from connecting to legal services, connecting to counseling on immigration, food pantry, all sorts of issues. So our program and our staff in that program really have to respond and have to be very adaptive to just about anything that comes through our doors. Last year we served over 1,900 individuals in that program alone. Our second program focuses on adult basic education. We realize that that's such a critical and huge need in our community. We are primarily serving Spanish-speaking adult immigrants, and most of the adults that we're serving are in their late 20s all the way through early 60s. We have been seeing a trend in the last few years that our adult learners are getting a little older. It's kind of interesting because we're seeing it on both spectrums of the age range. We're getting younger folks coming to our doors, dreamers, and we're also getting older individuals, folks who still have to make sure that they're able to contribute somehow to the workforce. And I think through that program, we really get to see a different lens of what poverty looks like and how it affects such a wide range of ages. Last year, we served over 630 individuals in our program. And our other program, and I think I just skipped ahead, it really focuses on educational support for young people in our community. We're currently at Bryan High School, South High School. This year we just started serving Bellevue West High School. The Latino community there is increasing rather quickly, and so we focus on truancy prevention, which is still a big issue in our community, and it's something that we're very much concerned about. Last year we served over 200 in that program. This is, I just want to give you a quick snapshot of Latinos in the country today. We are approximately 17% of the national population. Most of the Latinos in this demographic are actually native born. And I think it's really important to focus on those numbers, because oftentimes what we see in the news doesn't quite reflect who most of the Latino population really is. We're multi-generational. We represent a variety of socioeconomic and educational backgrounds as well. And Latinos, for the most part, are a very young population. The latest numbers have us, our median age is approximately 27. And some demographic models are also projecting that by the year 2050, 2 out of every 5 children in the nation will be Latino. Just some other quick facts nationally, just to put certain things into context. The Latino poverty rate is higher than the U.S. poverty rate. And although, for the most part, our community has reached record numbers as far as college enrollment, but our levels of educational attainment are still at the very lowest among different ethnic groups in our community and in the nation. Locally, just to give you a quick snapshot of where we are in the region. And as I say region, we're primarily looking at the metro area, which is Douglas County, Sarpy County, and Potawatomi County. There are close to 71,000 Latinos living in this area. What that means for the region is we're getting much closer to the 10% number. In the city of Omaha proper, Latinos are approximately 11 to 12% of the total population. And I also thought I would share with you some figures that we always pull in reference to education. We know that education is the biggest change maker in our community. Access to education. Are we also fulfilling higher levels of education? And that really completely creates or changes the opportunities for individuals to really mobilize in their community, have access to resources, jobs, etc. Now I'd like to get to the point on what is this connection between the overall health of communities and community engagement. And I went in and I did a little bit of research just to see what other larger systems are, how they're connecting engaging community to health outcomes in our communities. And I'll tell you that from our vantage point, and where we feel that we can help inform this conversation on health, it's really through looking at community engagement. What does it look like? Are we really seeing our community engaged at all different levels, and what does engagement mean? And I'll have to tell you something, that this conversation has become so real in the last several months, as Latino Center Midlands has been one of the many organizations really promoting the school bond and passing the school bond. And I think we did fabulously well, as the latest numbers are showing. But one of the biggest lessons really for us, even though we've been in the community for many years, we're a grassroots organization, we operate grassroots-based programming, but it was a level of engagement that we saw as we were going into the community, as we were talking about how schools are financed and why it's important to look at public financing and making the connection to quality education in our neighborhoods. And as soon as we were able to convene parents, we realized that this is an issue that's very important to them. Many of the parents in our community may not have such a deep understanding as to the connection between public financing systems and, at the end of the day, how that directly correlates to the quality of education that their kids are getting. But once we opened up those avenues of communication and creating a venue and an opportunity to have these conversations, it just completely exploded. I want to share with you a couple of things that I found as I was looking at how larger systems are conceptualizing community engagement, and I found these three. The first is that community engagement really means encompassing a wide variety of activities, from information sharing to community empowerment. And what that means is it really goes beyond just convening in a forum. It goes much beyond that. It really looks at how are we truly engaging community members in not only defining the issues, but also defining the solutions. It's also seen as a core approach to improving population health, and is a means of helping citizens understand the issues confronting their community and possible solutions. And I think that this is where a lot of us who do community work, whether we work for a nonprofit organization, we're a board member of a nonprofit organization, we're active in our church, this is where the rubber really meets the road. What is engagement really looking like? And are these communities that are primarily affected and we know that are disproportionately impacted by poverty, are they engaged? Are they engaged in evaluating systems? Are they engaged in also being at the table and talking about what the possible solutions are as well? So again, I just want to revisit what some of the challenges have been with us is, how do we create more venues to involve communities in the analysis of their issues? So again, it's not looking at individuals who live in South Omaha, for example, as targets for programming, but as change agents in their own community. And that's where I think we really have to start looking at how we're changing that paradigm. How are we changing those conversations for that? It's really critical that we have all communities participate and lead initiatives for change. And really, what I pose before you, and this is in large part a conversation we're having at the Latino Center in the Midlands, is how do we make change sustainable? If Latino Center in Midlands closes tomorrow and we're no longer offering basic adult education, if we're no longer doing something about addressing the issue of truancy in our communities, working hand in hand with the public school system, what happens? So it's really important that as we look at how we conceptualize issues around, foundational issues around poverty, and how that affects and defines situations for communities, that we're at the same time looking at how our community members who are affected by these policies, by these practices, by these services, are they at the table also providing solutions as well? So, I think that what we really have to do is ask ourselves, what is my sphere of influence? How can I then help promote and increase levels of engagement throughout all communities? And this is a great thing, I think, about engaging with a group such as this, that you're very well connected. You're leaders in your communities. Something that Carol said earlier to introduce these subjects today is that, in fact, we are leaders in our communities. And within our own spheres, within our own knowledge base, and our own circles, our social circles, there's a lot that we can do to really move along and push forward this issue about this paradigm change. That folks in all sorts of communities, whether they are primarily Latino communities, or African American communities, or refugee or immigrant communities, you know, the face of poverty doesn't have a race, it doesn't have an age, it doesn't have a name or surname, it affects all of us. And that's even in rural communities, I think we see that quite a bit. So it's really about, if as we look at solutions, as we look at how we frame the issue, or the issues, the foundational issues affecting poverty, it's also, again, looking at what can I do to really help include the individuals who are affected by these policies, practices, programs, also be at the table to help define their course as well. So I put before you the following as we wrap up my comments. As community members, it's really our responsibility to, again, help all communities promote the analysis of issues affecting our daily lives. All community members must be empowered to be strong change agents. And one of the most critical ways that we do that, and the ways that we can make that sustainable, is to continue to promote civic engagement and leadership in all of its forms. And that's one of the issues that we face every day. Even though we know that most of our programming, most of the outcomes, the indicators, all the data that we're tracking as an organization all points to education, but at the end of the day, if we're not doing our job to really engage our own adult learners and the youth that we're serving in really conceptualizing and connecting and helping them connect the dots between education and changing communities and changing situations for themselves, for their neighbors, for their kids, for their parents, then we're not really doing our job. We're not really doing this sustainably. So I hope that some of the points that I shared today it will help to further inform the way that we really look at engagement. Thank you very much. Really appreciate your time. And I thought I would share just a couple of the resources that I use when I look at data and look at piecing different pieces of the puzzle together. And I hope there's time for questions and some dialogue. I would love to be a part of that. Thank you for your time.